Nights awaken, onslaught's call. AI chains bind one and all. MAHA myths where wearables lie. Convergence creeps under sky. Digital exposed tonight. Fight the fusion, claim your light. Join the round table, break the whole. Sovereignty's fire, brave and bold. Through digital storms, our truth endures. The nights arise, forever sure.
Hello and welcome to another Technocracy Roundtable. I think this might be the most important one yet. We are going to be discussing AI in healthcare and how technocracy is using healthcare, and unfortunately, how MAHA is using MABA now, which is Make America Biotech Accelerate, to accelerate the technocracy. So we're going to get into some. I guess depends on how you look at it, but not looking so fun. So welcome the night to the roundtable. We've got the OG who has been warning us about technocracy, Patrick Wood. He's been warning us for decades, and he has several books on the topic. We've got Aaron Day, who is a crypto expert, and he has been covering a lot of the alternative solutions. So it's not technology we need to be afraid of, and he is really showing us that there are ways that we can use technology to counter technocracy. I got into this disagreement with someone on that actually today, that we're not fighting technology, we're fighting technocracy. It's very specific. And then of course we've got Craig Wenclewicz, and he has been following the markets for decades as well, and he has a show where he goes through the harmonic structure, and he is also seeing how this is coming through and how the markets are indicating how they're doing this technocratic takeover. So welcome, Knights. How is everyone doing?
Here we
Crazy
are.
time.
Very well.
Crazy. That's crazy.
I also had that same conversation today about technology versus technocracy. So that's a theme.
Did you?
Yeah.
Yeah. I'm like, they're like, how come you're using technology and you're trying to fight technocracy? I'm like, they're not the same. They are very different things. And I think technology has done some incredible things for humanity. Obviously, we are talking through technology currently. This is how people are able to watch this, is through technology. So yeah, I'm not opposed to technology at all. I am opposed to us becoming cyborgs. I'm opposed to the transhuman agenda, and I am very much opposed to the technocracy that they're trying to create. So yeah, different thing. But tonight we're going to talk about healthcare, and of course, those who remember, of course, Obamacare wasn't really the starting point, but that's when it really came to people's attention that they were trying to use healthcare as a means to transform and take complete control over the country. And historically, that's actually how they've always done it. They've done it through healthcare. So of course we're way past the atrocity of Obamacare, which I do believe was a complete atrocity. But now they're trying to convince us that through things like AI precision medicine, we're going to have all of these advanced cures and predictions to diseases. And there are things that technology can do that are very helpful for our health, but there is also the mass surveillance state that they're able to create through collecting all of our biometric data. And in fact, I just saw that it was really recently. Let me find it. It was, so I don't mess up the date. It was, let me see. But this was, I think it was October 20th, but I just want to make sure I get it right. Yeah, it was October. They created the Center for Digital Health and AI. So with just this month, we are now experiencing that they're creating it was the American Medical Association. And in fact, I can pull that up and maybe that'll be a good launch pad for us. And then I'll open it all up for everyone. Let's see if I can pull this up. So it's a AMA launches the Center for Digital Health and AI, and they said it's a new endeavor created to put physicians at the center of shaping, guiding, and implementing technologies and transforming medicine. Artificial intelligence and digital health tools are advancing rapidly, but without physician leadership and input, they risk creating unintended burdens and failing to reach their full potential. The new center will now tap the full potential of AI and digital health by embedding physicians through the life cycle of technology and development and deployment to ensure it fits into the clinical workflow and physicians know how to utilize it. Augmented intelligence will be a defining force in the future of healthcare, but right now we are barely scratching the surface of its potential. Digital health tools are everywhere and the technology has limitless opportunity, but if you don't understand clinical practice or clinical workflow, even the best tools will never fully be implemented, said the AMA CEO, Executive Vice President John White. By launching this center, the AMA leading this space so the physicians can have a say in technology and clinical care of the future. Our goal is to harness innovation, responsibility, and effectively so it effectively so it improves patient care and reduces unnecessary burdens on physicians. And so they say they will focus on policy and regulatory leadership, clinical workflow and integration, education and training, and collaboration. So, and they go on. It's a full website they put up. But that sounds kind of very concerning to me. So I'll turn it over to my knights. Any thoughts?
Well, I mean, I actually just did a podcast on this. That's very AMA of them. The AMA was designed to be a trade association to protect doctors and originally to kill homeopathy. This was
Yeah.
the original purpose of it, and it was very effective at doing this, to the point where if you were the spouse of a doctor and you were talking to people positively about alternative therapies or homeopathy, your husband risked getting kicked out of the AMA. So what happened is the number of doctors dropped by 50%, prices went up by 400%, but the whole thing has always been about protecting doctors. It's had nothing to do with health. So this is just the AMA coming out and saying, well, doctors are going to remain here and we're going to make sure that they get paid. Here's our plan for how AI is going to be implemented.
Yeah, and it was large. I didn't get to see. I'm gonna have to catch the replay. I saw that you were covering this, Aaron, but I've done several shows on this with the Rockefellers and the Flexner report. And this was largely, it killed the whole homeopathic industry, any natural healthcare. And what's interesting about it actually is that the Rockefellers were not like pharmaceutical people themselves. They actually very much advocated for homeopathy. It's a rules for thee, not for me, as they say. So, but they realized that it was very, very lucrative because they had a control of the petroleum industry, and now they realized that they could use this, and they were advised in order to push this into petropharmaceuticals. And so they de-incentivized all of the schools that were not training pharmaceuticals and all the licensing boards, so nobody could get funding. unless they were doing specifically pharmaceutical as opposed to any kind of naturopathy or homeopathy. And this same actually went for psychiatry. They didn't see the point in it at all. It was Alan Gregg, who was one of their financial advisors, who said that this would be a great you know place for them to get into. And so they heavily pushed the pharmaceutical industry, but it was, yeah, based on,
Well, and
that.
it was waste
And
products,
Gregg
right?
was
They
connected
were,
to Flexner as well. Sorry, go on.
yeah. And they were using waste products, right? So it was getting rid of some of the waste left over from the oil. They also did this with aluminum, right? The fluorosilicic acid, the fluoride that they put in the
And
water, right? It's a
fluoride. Yeah.
fluoride, yeah. So essentially the fluoride, exactly. So it was waste product from the aluminum industry that they put in the water, and then also the same thing here with waste products from from the oil industry that went into the pharmaceuticals. So pretty convenient, pretty efficient use of leftover goods.
Absolutely. Yeah. Um, this, sorry, I think we're getting some questions here. Yeah, so now we can see with AI, they're doing something very similar. The Rockefellers were also very instrumental in creating the American Cancer Association, and then we saw this was it last year or the year before with Biden and the moonshot, right? Cancer moonshot, which was also connected to this predictive AI um, technology. They were that now Stargate is saying that they're going to use to predict, and of course, they say they can cure the sea illnesses. I don't know how much we can say, so but I'm sure people understand what I'm saying. But yeah, that's what they were, that's it's always couched under the guise that, it's going to be advancing cures, and that now we're going to have all of these tools to be able to predict, so we'll have a, faster intervention, which sounds great, except that now they're collecting all of our data, and historically they've had all this information, and they have not cured the things that they've poured, hundreds and hundreds of millions into. In fact, when you go to the American Cancer Association website, they actually say that. They talk about the, hundreds of millions dollars that has been put into this research. And in fact, the shots that went around, right, in 2021, those were created under Moderna, under the guise that they were going to be a cure for sea illness, and it was catastrophic in the results, and so, but of course they pushed on anyway. But they, on their website, they say this, they say that, we poured in like hundreds of millions of dollars, and they're actually further from getting from the cure, but if we keep pouring more money into it, I'm sure we'll get closer. So that's what they tell us. So um yeah, so and now we've got MAHA and MABA. And this is really concerning to me because I know so many people, this is always how they do it too, right? They entice you with it's like an opt-in. So all these people went out and bought wearables, of their own volition. And I think there is a lot of advantage to being able to have, data, to be able to take ownership of your own health. But now he's saying that this is going to be, something that's going to be mandated. He wants everybody to be connected to wearables, which of course is, there's the internet of wearables, which is connected to the internet of things, which is connected to the internet of everything, and which will soon be connected to the internet of nanobio things. So, and just the fact that most of these, not all of them, there are wearables that you can sever any kind of outside, sourcing, but a lot of them are, your data is being sent off. So what they can do with that data is very concerning, and especially when you start thinking about the insurance implications of that. What are your thoughts on all of that?
Well, I went through some of the different wearables just because I was curious, and there's a lot
Hmm.
coming out for the holiday season. So there's a whole new series of them. They've got the Aura Ring, Smart Aura Ring 4, which is I think $350. They have the Withings ScanWatch 2, which is a hybrid style smartwatch, and then they have the Fitbit. I think that Withings one is like $370. So those are the two highest priced ones, and they have this Fitbit for $160, and then obviously the Apple Watch and all the other ones that they know. But what they're sensing with these, obviously we know heart rate, that's been around for a long time, and then they have the heart rate variability, right? The changes in the heart rate. And then they have the SpO2, so they're checking the blood oxygen saturation levels, and they're using optical sensors, which there's obviously a lot of questionable readouts with some of this stuff. I think it probably works better on some people than others. And then they're working with some of them have ECGs, electrocardiogram, so they're looking for irregular heart rhythms. And then some of them are saying that they can estimate blood pressure, and they use sensors and algorithms to determine arterial stiffness. And then they're even coming up with these ones now that are medical grade. I don't think that fits in the category I was just going through with the Oura Ring and so forth, but these are supposed to actually track heart and lung issues. And then we have these all day, and they're all day, everyday trackers. So you're wearing them all the time. So like you said, Courtney, it's pulling a lot of data. And these are big business, right? For Apple, this was a big business add-on, right? Because it gets you in their ecosystem, right? So that's the whole thing. Apple has this massive ecosystem, and once you get their wearable, it just keeps you connected to the iPad, your phone, right? The Mac Minis, all the different devices that you have, and everything's connected in one big. So it's really a transfer, and you wonder how far reaching does some of this go when you start connecting all these different devices up that are in one ecosystem. How much does that open you up for actually not just the information coming off your body, but the information you have stored in different locations? And that was one of my big questions. I don't know the answer to that. I mean, I'm only a tech guy as much as I have to be. I'm not a tech guy because I want to be. So, so that's essentially, and the claims are with this stuff that, that the University of San Diego, I was looking at, they were doing a study where they're actually doing a microneedle now, right? And an ultrasonic ECG, so electrocardiogram. And so that's measuring glucose, lactate, alcohol, blood pressure, arterial stiffness. This is pretty invasive. We're getting pretty far down the track. And here's the worst part. Let's say that it's inaccurate and you're actually getting data going out. And now your insurance company, like you mentioned, insurance company, what if they're getting a readout? You might have to fight for a long time to actually get that erased off your record. So it just opens up a bunch of things, just so many things. You could go for hours on this.
Yeah,
Your
and I
thoughts?
think the big concern is what the intention is to do with it. And again, we talked about technocracy is not the issue, technology is. The problem is that all of the companies, particularly the ones out of Silicon Valley that are working on these devices, if you want to look at the terms and service of these agreements, they can do an awful lot with your data, and they definitely have the intentions to do a lot with this data. If you look at Operation Stargate, which is the $500 billion project that Larry Ellison and Sam Altman and SoftBank are involved with, that part of that is to create real-time healthcare data through what are called Stargate outposts. So the whole idea with this is to continually collect health data. And wearables are a big part of this. So your vital signs, your glucose levels, activity, stress level, all of that, and to then summarize it, to come up with scoring systems, and to even come up with, at some point, on-device decision-making. So, for instance, the device will decide when you need additional insulin or when, third parties need to be notified. So they are building this intentionally to be a completely centralized control system. And certainly the wearables that are coming out of Silicon Valley fit into this overall strategy. And it is very dystopian when you see where they're going in terms of predictive health, and where this ultimately leads, which is to rationing and the loss of independent choice with respect to healthcare outcomes.
Absolutely. I mean, I know we've talked about this before, but there's I believe it's Abilify is the drug. But there's the very famous clip of Albert Barola where he's talking about how you take the pill, and then when you swallow it, like there'll be some sort of a remote interface where we'll know if you've taken your dose or you've missed your dose. And of course, they frame this as this is going to be great for elderly people with dementia who might not, remember their last dose, or a lot of us forget when we take things. So this is again for your convenience and for your health is how it's being prefaced. But if they're doing that, if they can already do that with pills, and Abilify is actually like a pretty popular drug. Like I think it's I think it's an SSRI actually. So yeah, it's pretty common. This isn't like something that's super rare, and they already have that technology and they're already using it. So yeah, with the sensors, it becomes incredibly concerning. I know they were doing a lot of this testing with back in 2020 in the hospitals, and they had these medical wireless body areas. So people would have sensors, and of course, there you knew that you were being tracked, and it was under the auspices that the hospitals were really full and busy. And so this was a way to kind of keep track of people's vitals and their biometric data in order to monitor them, things like their oxygen levels, which was a big concern at that time. But as we know, that period was quite a test of many things. And I feel like they were definitely doing some sort of beta test. And again, with the wearables, it's the kind of thing where initially people opt in. You can choose, and in some of these technologies, you can even choose to turn off, any data reporting. Not all of them, but some of them you can still do that. But what happens when they flip it and it becomes mandatory, and then the data that they've uh, accrued becomes part of your social credit score? And now what happens when they create the regulatory infrastructure and they push through all of the digital currency? And we have that what was it, the 666 patent, which was the cryptocurrency well, I don't remember the exact wording, but it was like your essentially biometric data activity, and it did too. And that was the patent. It was a Microsoft patent. So what happens when if they decide that they want to connect all of that? The amount of control they could have over people is pretty horrifying.
Well, and they do want to control it. And so part of the problem is that Palantir is being brought in to aggregate all of this healthcare data, which, by the way, they're also doing. They won the contract to do this for the NHS in the UK. So they won a 330 million pound contract to begin aggregating all of the information about every single citizen in terms of healthcare information. And this is essentially what the next step is here. And one thing that people don't understand, and when I was doing research for this podcast that I did on Monday, is at this point in time, the US government pays for about 47% of total healthcare spending. So the US government is the largest purchaser of healthcare, and they set the standard and the terms for everything. So if RFK gets in there and says, oh, well, we want to make America healthy again, and the way we're going to do that is through Palantir AI and wearables, then when they mandate that through the government, then that becomes a downstream effect. And so then all of a sudden you're going to end up in a situation where everybody is mandated, whether you're getting it through, quote, private insurance or from the government. And that becomes devastating. And I'll give one quick example, which is when they start mandating things like, well, it's the new standard of care, or the current standard of care. You have to get mammograms so frequently, or you have to get colonoscopies. We have a situation where a lot of the diagnostic tests that are done actually do more harm than good. And this has been found, mammograms have ionizing radiation. CT scans have been known to also have ionizing radiation that's carcinogenic. You have all kinds of issues with dental x-rays, colonoscopies, on and on and on and on. And so the problem is that we're talking about the complete centralization of this, but interestingly, it's coming from the government, but through the technocrats and through big tech and AI influence through the government.
Yeah.
Well, and keeping in mind the pill that you would take with the Abilify, is it Abilify? I think that was the name of it. Is that correct? Is that right?
Yeah, I'm
Yeah.
pretty sure that was the drug. I'll have to
Yeah.
verify it, but I'm pretty
Yeah.
sure that
I
was
think
the one. Yeah.
think it showed up on the screen there. But if you think about this, the connectivity. So now you have this pill you're going to take, and then it's going to communicate with a wearable like your watch or your phone or something. And then that's going to go back to some central database that says you haven't taken your pill. It's going to come back. And so if you're a doctor and you really care about your patient, and you say, I think we could take care of this and get you off this medication with good diet and a little bit of exercise and things like that, can you actually get off of it? Because you're in this ecosystem that's not only on your body, it's in your body, which is just completely bizarre. So hopefully that ties in with what Aaron was saying, in the sense that, you you really can't get off of it once you're on it, because the government, it's really a pretty scary situation, because you really are connected. I mean, you really are connected.
Yeah. Patrick, what are your thoughts on this?
Well, I want to take a more of a holistic view of medicine and talk about AI in the doctor's office. That's where it
Oh, yeah.
starts today. And doctors are presented, and PAs, whatever, they're presented with forms, if you will, electronic forms, where you present yourself with a problem, and they go through the checklist, whatever the screen tells them. They have to ask those questions, and they try to figure out the answers. And you may not like the answers, but nevertheless, they have a like today, when most of the information, patient information, is collected in the office, medical office, it's being they present them with a unique questionnaire for your problem at that point. They have to go down the list. And when they check a certain box or something, your temperature is off a little bit, or your blood, your oxygen level is a little off, whatever, they have to check off these boxes. And the end diagnosis, whatever you're there for, maybe you have a cold, maybe you have an infection, maybe some other thing. The diagnosis that is eventually given to you won't be determined by the doctor necessarily, but how he fills out those forms. And they're geared at this point to present something may not be true at all, but it'll present you with some diagnosis that the doctor might even disagree with, but he has to follow the protocols at that point. And when that whole thing then is fed into the system, and you're given the medicine, maybe some recommendations to take some medicine or whatever, then that gets in the system, and that's a permanent part of your record at that point. It may not be true at all, but the doctor goes through the motions or the PA goes through all the motions to check off the boxes just like it wants them to do. This is very dangerous, for one thing. But doctors are getting lazy because they figure if they want to get paid, if they want the insurance companies to pay them, they have to go along with the diagnosis that the AI basically says that's what you're going to get paid for. And if they see some way to swim upstream, maybe they want to do a certain type of test on you. The doctor said, well, I'd like to do that, but I can't get it approved. I'm sorry, you're not going to get that test. So at this point, the front end load from the medical offices around the country, they're being skewed by AI to produce faulty information in the first place. That's my whole point. On the back end of that, if your doctor recommends a test procedure, they often do, and they say, well, I want you to see a neurologist, or have a PET scan, or an MRI, or some other test. At that point, you have to have your test scheduled before you can receive it. And in most cases now, I think probably almost all cases, all of this pre-screening for a test is done by AI as well. It looks at your whole spectrum of information and says you're approved for this test, or maybe you're not approved for this test. And you'll have no explanation other than that it just denied you the right to take that test in the first place. This is the second level of AI that you're going to be faced with in the medical world at this point. Where is this headed at that point? Well, all the information along the way is fed into, it'll be fed in now to the systems like Palantir, where anything any checkbox that gets checked along the way. You complain you couldn't get your test on time, whatever. All this stuff is going to be fed into into the system to rate you for even getting health insurance in the future. People are complaining about this around the country. I've seen so many reports from people in the medical field, and as well as just people who wanted to get something done and they couldn't get done, and it's detrimental to their health if they don't get it done. So AI is taking over the whole space at this point. That's my whole point here. They're taking over the whole space where you can't get loose no matter what you do.
Yeah, and now they're talking about AI practitioners. So I I I can just imagine what could possibly go wrong with now.
Well, in China, they already have an AI hospital.
Yeah,
It's
they
a
do.
virtual hospital. They're treating
Taiwan too,
5,000
I believe.
patients a month. Holy mackerel. And what's that? What does that
Mhm.
mean? Well, you're never going to see a doctor there, and you'll be presented with a screen or maybe a camera, and it'll look at
Yeah.
you and answer some questions to it and whatever, and it'll prescribe your medicine on the spot. Maybe won't deliver to you, but the AI hospital in China, this is the future for medicine for them. They don't have enough doctors to go around, frankly.
Yeah.
Just imagine going to an AI hospital. You never see a person, never see a doctor, never see a nurse, and you're at
Yeah.
the mercy of the AI prompt, basically.
Yep. When
Yeah,
what you're
I'm
saying
pretty sure
too is,
Taiwan has it too. That's pretty scary. Sorry, Greg. Yeah.
yeah. I think what you're saying too is that, it's really garbage data in, and so you're going to get garbage data out. And not only that, if there are any doctors left, you know, you get a doctor out of medical school, right? And they have good intentions. And then they realize I have to join a group. And then they join a group, right? Because they can't survive on their own anymore. You can't be a independent. It's just too expensive. The insurance, you can't afford it. So what do? They join a group. Now you've got groupthink on top of it all. I can't do this because that would be outside of the group policies. I can't make this decision. So you lose your intuition with this AI. That's, I guess, where I'm going with this is you start to lose your intuition as an individual, as a healthcare professional. And you start, and again, like Patrick was saying, they start to get lazy because they don't really have a choice. They can't really make a decision because they're in the system. They're in their group system. They're in the overall medical system. And when they do make a decision, they have to cheat the system, right? Because I've been in to see the doctor, and they're like, "Look, you're not going to get approved for this unless we do this, and we're going to have to submit it like this. We're going to have to do this," and they know how to circumvent the system. Problem is, when does that stop? When does insurance company come back and not allow them to actually go around the system? Because that's coming, right? That day is coming where a doctor can't even circumvent the system that's put in place for them to follow. And that's
It's
my
already
biggest,
here.
yeah.
It's here. So,
But
sorry, go on.
it's moving fast. Yeah, it's moving fast. And I think the biggest thing here is the loss of intuition. Okay. That's the biggest thing I see with markets, the thing I see with the healthcare, the thing, no matter what angle we look at this technocracy from, it's really to take away our human intuition. And we really lose that part of our brain pretty quickly. And that's to me the most concern. And you can't gain it back. Once you lose that, I don't know if that can be regained. That's another big concern for me.
It's a huge concern. So China does have it. It's a Tsinghua University Agent Hospital, a virtual hospital staffed by entirely by AI agents for diagnosis, treatment, planning, and it's also used as a training platform for medical students. So the students are being trained by AI. And then Taiwan, the China Medical University Hospital uses a range of AI algorithms for diagnosing diseases, treating patients in emergencies, and reducing paperwork for staff. I knew about those. I did not know Israel has one. The Sheba Medical Center has an AI powered emergency department called Project K that uses AI to automate administrative tasks and improve precision of medical assessments. And then there are some other locations, other ones in China. So I can't help but feel like there's some advantages to like a telehealth. I know that became very popular in 2020. And there are some, there's time and place for it, definitely. But I can't help but feel like that's some sort of a preconditioning or like infrastructure setting up for an AI practitioner, because now it's you're doing this remote kind of a interface, and then the next step will be just to have the robot intake, or some sort of just an AI. You don't actually consult with the person.
Well, the other
I,
the other
I
part of that is that it's been proven that like just the touch of a doctor, you know what I mean? Like a doctor coming in and caring, that's sometimes curative all by itself. So we're that's just totally going out the window. As soon as we go to the telehealth, like a lot of people that I think it's been proven. I think you can find studies. I remember reading this before that, just the human interaction with a doctor that seems like they care is sometimes enough by itself to get you over the hump and get on the self-healing phase of stuff, right? Just the mind part of it to let your body actually heal. Sometimes it's just giving, someone else giving you authorization to do that. AI is not going to do that. It's not going to give you that authorization. It's going to be a cold 0 and 1 and a 0 and 1 and 0 and 1, and it's not going to engage that part of the human being, right? That will heal on its own.
I think we need to focus on the fact that the current system is broken anyway, though. Adding AI doesn't change the fact that doctors still have to follow the standard of care, and the standard of care today is written by big pharma, and so they're not really practicing anyway. They're actually just following orders today. So we have to get to the root of the problem, which is actually the existing system. AI is just going to amplify the wrongs of the existing system. But to talk about how bad the AI thing is already, we can look at claims. So, for instance, United Healthcare has a whole bunch of lawsuits against them. And a lot of this is related to the fact that there have been just a huge increase in AI-driven denials of healthcare coverage, like
That's
on
right.
a massive scale. I mean, we're looking at this through class action lawsuits, and the AI algorithms are pre-screening claims for medical necessity, and there are all kinds of high-profile cases where this has gone completely wrong. Up to 90% of these AI-driven denials are later overturned by judges on appeal, but this is how bad the information is that's coming out. And it's not like United Healthcare had a stellar track record for, how they handled and processed claims before, but this has made it that much worse, and it's leading to the deaths and injuries of people all over the country already. Like not in the future, but right now.
Yeah, the standard care is a huge problem, but I think it's going to get much worse with AI. So, as Craig was saying, that sometimes doctors can circumvent, and I've experienced this personally, but there's a standard of care. I can give you an example of like a medication that I've been on for a very long time. I have glaucoma. I was diagnosed when I was 9 years old. So this is, I was probably born with it. We don't know, but it's been a very long time, and there's really only one prescription that works. And my doctor has to go through hoops because of insurance in order to get the prescription. And without the prescription, without like the insurance, the drug itself is like hundreds of dollars. It's insane what they do to make and it wouldn't be that expensive if it weren't for insurance. So it's like all of this is downstream. It's a major mess. It's a whole web to untangle. But the standard of care, it's like they have to go through all of these processes just so that they can so that they can even be able to give you the prescription, even though they already know what's working, because like the patient who's already been on it, or I mean, that's it takes all of that human element out. But now when you add AI, it's literally just clicking like check boxes. So
Hmm.
there is no like nuance to it at all. And we see this all the time with humans, right? When now, because it is protocol driven, and a lot of this is because of insurance. Insurance is a huge part of the problem, but they are not. They're really just like checking boxes, right? So they're trying to play like matchmaker. Like, okay, you've got this symptom, and now we're gonna find this pill to give you, and then we'll check off this box to follow the standard of care. Whereas many times that's not going to help. I mean, that's obviously not going to get to the root cause. We've seen what a problem that is, that, doctors are very rarely looking for any kind of root cause, looking holistically. But when you have AI, I don't think they're going to be looking at that at all, right? Now, you could see, now just to play devil's advocate, because we started off by saying how technology isn't the problem, right? And technology can actually be helpful. I can see a scenario where if the doctors are not outsourcing to AI, not being lazy, where they're not learning, and where they're not using their training, their talent, their intuition, combined, because I think it is a combination of science, intellect, and art, right? I do think all of those come into play. There is definitely kind of that, intangible element in medicine, or at least there should be. But there could be a situation where they could be using this in conjunction, right? To diagnose. They could be there could be some sort of a symbiotic relationship, but that's not what we're seeing happen. And it's much like that's not what we're seeing happen with AI in general. There are people who are using AI, and it is leveraging their, expediting their productivity. They're using it as a tool, and it can be very helpful. But the majority of people are just completely outsourcing their cognition. When you start to have doctors completely outsource their cognition, I think we get into a very scary place, especially when you start talking about surgeons. And they are talking about like AI surgery, like robotic surgery. And to me, that's very terrifying without any kind of human oversight.
Let me give you a study recently that was conducted measuring doctors' ability to diagnose cancers, that using whatever scans necessary. And the study was conducted with a control group, and then measuring that against AI. Whatever AI came up with as far as diagnosis itself, the doctors that used AI, they lost their ability to correctly diagnose in the first place based on what they lost because they were relying on AI. I think the thing was conducted over like 12 months period. And so then they measured, they took the AI away and the doctors had to do their thing manually, if you will. Well,
Mhm.
the study measured that those doctors, their capacity to understand and recognize disease shrunk by 20%. That's huge. That's in 1 year time. When they were not on the cutting edge anymore. They relied on AI and their cognition went down. This is probably symptomatic of the whole industry at this point, and not just surgeons, not just diagnosis of cancer, for instance. But I think we can probably extrapolate across the whole industry, doctors in the office, PAs in the office, people in the insurance companies, you name it. When people rely on AI to do their job, they're going to be less efficient to do that job in the first place.
Yeah, I agree.
Manually.
Well, and here's some more bad news, which is that starting next year, Medicaid and Medicare will be implementing AI as well. So this is part of this Executive Order 14179. So you're going to see AI involved in decision making for those areas as well, which again is now 47% of overall healthcare. So so literally by next year, the majority of healthcare in this country will be determined by AI.
Well, and we know that some of the best healthcare out there it's old school. This isn't hard to figure out. If you set up a situation with a really good doctor, maybe an Eastern style doctor, or you find a good doctor out there that actually really cares, because not all doctors are going to go for this, right? They're going to be doctors that resist this, okay? Because they got into this and they haven't given up, right? They're going to fight the system, because they got into this for the right reasons, and so they're going to fight this, and And we know that if you, like, let's say you set it up where it's $100 a month, okay, and you're going to pay them $100 a month, you might not really use them for more than an hour or two, because one year you're perfectly healthy, you go in for a little checkup, whatever, it costs them $300-400 to do the tests, you pay for the test separately, and so forth, right? And you get good feedback, and you watch your diet, you follow their instructions to exercise, and so forth, right? So now you're engaged with your doctor. All the right parts and pieces fit. The problem is that, like Aaron was saying, this whole thing's gone into the healthcare system where this AI is really becoming a massive game of the haves and the have-nots, right? The financial side of things. You have the haves, and you have the have-nots, right? And for instance, we just saw car loans went to 84 months, right? 72 months was bad enough, but you can see people are getting stretched, okay? And so what happens is they get super, super stretched, and they can't afford to go pay that $100 a month, because now they're on the essentially universal basic income, the government system. They can't get off of it. And then we talk about the same thing with using this AI. The people who can use it effectively can become incredibly more productive than people who aren't using it. So financially, it's a big stretch between the haves and have-nots. And then just productivity wise, it's becoming a haves and have-nots thing. And then from the medical, it almost just feeds down into this fatal funnel where it's the same kind of a thing. It's the haves and the have-nots. You can't even afford to go pay $100 a month to get the care that would probably be best for you. That would, where someone would actually give you real advice instead of some computer, some AI system that's going to send you down the drain. I mean, it really is there's three fronts that it's really, this AI is just creating that separation.
Yeah, definitely. And I think that, it's right to look at the current system and how this is going to be magnified, because they're already not really thinking. I mean, I've experienced this firsthand with so many doctors. Like at one point in time in history, you would go in, and even, not so long ago, you would go into a doctor and they would do a full intake, get your whole history. Now everything is done through portals. So you don't actually talk to your doctor. You have this portal system, and they keep saying that it's so efficient. I don't know what your experience has been. My experience is this is not efficient. I've actually had experiences with doctors where it's been a full year to get anything accomplished and to actually talk to the doctor, because you're going from one portal to the next portal to the next portal. And they're supposedly collecting your data through this portal. So, under the auspices that the doctor is going to look at this data, and that they'll have a better sense, when you actually get to talk to the doctor, of what, your history, your medical history is, what, they can possibly do and how they can work with you. But my experience is that has not been the case at all. You come in, the doctor now only gives you 15 minutes. Sometimes it's not even in person, it's an, digital interface, and they haven't even read the material. So what is all that data for? Is it just being collected? Like, w- so supposedly the doctor should have the information. So I think, this is all one of the big things that this is being couched as, is convenient and efficient. And my experience is it's actually been neither, and it's been way less efficient or convenient than, dealing with a real doctor. But because they've been trained in this allopathic method where everything, and a lot of it is because of insurance, they have to, they have to give a code for everything. So there's like the medical codes, and so that's what diagnoses are all about. And of course, diagnostics don't do much for, their time. There again, that I don't want to be like, too universal about everything. There's a time and a place for a diagnosis where it can be helpful and you can have an appropriate treatment, and there's times to treat symptoms. However, when the reason for all this diagnostics is largely to be able to code it for insurance, it's not because it's helpful to the patient. Just it gives you, they might have some sort of a, pill to give you, but you're usually just a blanket for a symptom. So when you add AI to that, though, now it's all just, there's no nuance to anything, and there's no comprehensive, like, holistic approach. It's all just data matching. So
Hmm.
yeah.
Next subject.
Well,
Can I share a screen
yeah.
possibly?
Yes, I think so. Yes.
I'm going to try it here.
Okay.
I can, let's see, okay, let's see. Shoot.
And while he's doing that,
I
one thing let me add one thing, Courtney. So I think what you're
Yeah.
talking about is a decision support tool. I think we're all fans of decision support tools, right?
Mhm.
If whether no matter what your expertise is, if you have a tool, a computer, AI, whatever that's helping you make a decision, that's a decision support tool. This is going right around all that decision support tool. This is actually this is a big infrastructure thing that just it's a one-way street, right? One way data in, one way, portals out, and very little human contact with a doctor that's actually, you know, can is actually even been allowed to care. So that's the difference. Does that make sense? A
Yeah.
decision support tool. That's my perspective anyway. It's not a decision
Yeah.
support.
Yeah.
No,
Yeah.
and
Yeah.
it totally could be. I mean,
Right.
I've interfaced with questions that I had, and you compare it with other research, and then you could it can because it aggregates so quickly, right? So it actually could be a helpful tool, but it's not a
Sure.
helpful tool when it's being completely outsourced or when it's running the show. Very problematic, but that's the direction that it's heading in. Well, are you able to find it while you're looking for it? I'll just read this
I
really
can.
quickly. It's
Yeah.
oh,
I
you
think
got it.
you have to present it, I think. Not
Okay,
me,
okay.
I think.
Yes, I think that's right. So we'll present it. I'll read this while we're getting that squared away. But this
Okay.
is from RFK. He says the mission to make America healthy again is MAHA. Includes MABA, Make America Biotech Accelerate. President Trump showed in his first term what happens when you unlock the American science breakthroughs happen fast. Now we're going to do it again. We know the power of US biotech. It's time to let it flourish, not tie it up in red tape, misalignment, and a process that gives the edge to foreign interests and large incumbents. We're clearing the path to transform great science into real cures at lower cost and better health for the American people. Life science and biotech are at the heart of that. So, yeah, yeah.
Mm.
Um, this is I think a lot of people feel like this is a huge bait and switch, but this is really all part of that, like, yeah, the One Health initiative, which is UN agenda, right? The One Health, which is the like animals, the planet, and human health are all part of like a well-being holistic ecosystem. And a part of how they determine that is through this data, right? Under the auspices that we have to save the planet, that, the Malthusian lie that they all subscribe to. So, so
That picture, I saw it just briefly.
okay, pull it back up.
That one right here.
Mm-hmm.
Um, I want to just explain this a little bit because this is this concept of One Health. This is pervaded medicine, top to bottom, and there's One Health websites in every agency at this point in our government. It's amazing. I did a search and I found so many that were talking from different aspects, talking about One Health. You see
Yeah.
on the first type in the first circle there, see humans. That's you and me. We're
Mm-hmm.
the low man on the totem pole. Then you see public health. Beyond that, then you see global health. Then you see One Health. Then you see planetary health. Well, this is all based on Gaianism. That's the worship of Gaia that says the earth and everything in it is one big organism.
Yeah.
And so your health is connected to the ecosystem. It's connected to the animals in the field and the chickens or whatever, and all these other things in the world that can affect your health. This is being factored into the medical system at this point, top to bottom. I have a quote here from the CDC website. They have their own private website. Well, it's not private, but there's a public page for it. And this is what it says. One Health is a collaborative, multi-sectoral, and transdisciplinary approach working at the local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between, gets this, people, animals, plants, and their shared environment. One Health is an approach that recognizes that the health of people is closely connected to the health of animals and our shared environment. One Health is not new, but it has become more important in recent years. This is because many factors have changed interactions between people, animals, and plants, and the environment. That's a direct quote off the CDC website. This is crazy stuff. I mean, this is woo-woo stuff at that point, right? It's just like, well, how much now has this really infected the diagnosis that we're being given? And you have to figure, well, it has to affect it somehow, obviously.
Yeah.
And I'll tell you where you can see this directly is in something called the Lancet diet. If you thought the USDA food pyramid was bad, wait until you see what the Lancet diet is all about. And this is a perfect example of where humans aren't first. And so the whole concept behind this is we have to move to a plant-based diet. Their little, pyramid or circle actually has added sugar in it. And it has almost the complete elimination of red meat. And this is where you get things like the introduction of insect protein. Well, why is that? Well, when you read into it, it's about the planet. It's about saving the planet. Humans are not first in the Lancet diet. And so, yeah, there you go. Look at this, added sugar and all of these other things. And so this is absolutely insane. And so that was really eye-opening to me, was in studying the USDA food pyramid and looking at these things. I always had this crazy assumption that when these people put out these guidelines, it was to optimize and improve human health. And when you realize that that's not the case, it's pretty shattering, actually.
Yeah, it's very much the opposite. What was it, like the sugar industry like paid the Heart Association to demonize saturated fats. Yeah,
Yep.
then that's part of how we got that food pyramid. Yeah, it had nothing to do with health at all. That was all a for profit, and I would argue probably partially a depopulation agenda.
Yep.
I mean, all of those, right? I call the 80s, which was largely when they started introducing all those trans fats and, demonizing any kind of natural fats and saturated fats. I call it the Snackwell era because, they had all these like fat-free snacks and, but they all had these trans fats and added sugars. And since then, we've seen like disease skyrocket. So this was definitely not about health at all. I mean, it was very similar to like the Bernaysian, William Morris kind of propaganda for smoking, right?
You mean it was recommended by 9 out of 10 doctors to smoke camel?
Yeah, exactly. Yeah, exactly. Right. Right. It's for your health. The doctors know. Yeah. So, next they're gonna say it's for your health to have your infant stare at a screen for 9 hours a day. Yeah.
Well,
So,
it's always about confusion, right? I mean, that's the thing. I mean, don't you feel like it's always been about the whole medical system, at least my whole life, it's always been about confusion. It's like as you get older, you watch these things and how many times for 10 years there did we see red wine's good for you, then it isn't, then it is, then it isn't, right? I mean, how many times? It was like literally it was constant article. So it was always about confusion. The whole process is about confusion, right? And if you really want truth, you have to go searching for it because they're not putting it out there for you, right? I mean, it is not. And it's kind of like Patrick said, it's all about this concept of the one earth. It's the same thing they tried to pull, with the whole ESG, and it's all this stuff's all tied together because they really want you to buy into this, this whole looking at it from the financial perspective. It's really about accepting this global perspective on hey, all this debt's fine. I mean, right? It's always about confusion. If you want the truth, you have to go searching for it because they do not, no matter what angle you're looking at it from, they do not present it to you easily. And all that they collect, it should be so easy to lay things out. This is, for this type of blood type, this is good for you, right? I get it. Not everybody's the same, right? And everybody should be, fit in, And there are categorizations of things, but I think it's all about confusion,
Yes.
right? I mean,
Rumsfeld, who put in the aspartame, right?
Yep.
And that was also in the 80s. Yeah, that's where we got our sweet and low, was it? Or is it equal? I think it was equal.
Equal. Yeah, that one was equal.
Yeah, equal. So interesting, the One Health stuff. I thought there were like One Health centers. I'm not finding it now, but I thought actually, because I remembered when I lived in Santa Monica seeing a One Health, like kind of like an urgent care or a not necessarily urgent care, but that kind of like a clinic. And I thought they had One Health center, so I was looking up, and I'm not finding that. But what I did find is that like every state has a Department of Health, and they have a
Yes.
One Health initiative in each state.
At least a page. You'll see at least a page on it.
Yeah,
Mostly
yeah.
copied off of the CDC website.
CDC. Yeah.
Yep. That's
No,
Tennessee.
this.
There you go. One Health.
Yeah, right. That was
Yeah.
what I found right away.
Yeah.
The Tennessee one. Yeah. No, this initiative, I remember covering this when I was trying to fight the NACS, the Natural Asset Company, because they were tied into this whole One Health agenda. It's also tied to the economics agenda too, like, right? They call it well-being, and it's all
Yeah.
the well-being is the holistic with an H, it's about holism, which is this whole planet. It's Gaia religion. Yeah, the worship
Well,
of
this was the original objective of technocracy from the get-go, was to manage all the resources in the ecosystem, however you would define that. They wanted to
Right.
manage everything, top to bottom, people included, your mind as well. That's why they talked about the science of social engineering, and all the resources in the whole world could be managed and given to people as products to consume at their discretion. That was a plan from the beginning, and this is the same plan today. It's top-down management of everything in the universe, basically.
Yeah, and AI makes this all next level. And one thing that we didn't touch on with respect to doctors, if you actually look at what's going on in medical schools now, top medical schools, Stanford, Harvard, Johns Hopkins, they're now requiring AI integration in the curriculum. So the new doctors that are being churned out are actually trained to be kind of subordinate to the algorithm. So this is what we have to expect from the cutting edge doctors coming out of medical school today.
Yeah.
They're learning how to use AI instead of learning medicine.
Yep.
Yeah.
Yeah. This is bad. And again, part of preparing for this roundtable, I've been doing a huge deep dive on all this, and I'm horrified. And once again, about how far behind I am. If you think you're on top of this stuff, you're not. It's amazing what's going on behind the scenes, and I think in this healthcare area, this may be the most dangerous vector for technocracy. And with Stargate and what's going on with medical schools, and again, I didn't realize AI was implemented as far and broad as it is with insurance and now Medicare and Medicaid and everything else. It's incredibly alarming.
Yeah, and I mean, I keep going back to the biodigital convergence because that's really does seem to be where this is all headed, and AI makes it really possible. That just to me is the kind of control that they can have over people. And they don't need, I mean, the wireless medical body areas that they were testing in 2020 show that they don't have to implant anything. I mean, they can really do remote control interface without implanting anything. I mean, in that scenario, people had sensors, so there was some sort of compliance. They agreed to put on the sensors, but they have technology where, I mean, they've shown where they can hold something up and they can read your temperature like from far away. I mean, that's just one example using light, and but if they can do that, I mean, there's a lot more they can do. Yeah, this is the Purdue Center for the Internet of Bodies, where connectivity, security, and intelligence meet human body to transform life. And I think if you scroll down, it says something where like your home is your body is the home. I'm not sure if I can find it, um, but essentially it was talking about how like they're running through you, like you are the interface. And this right here on this website, it's a this Purdue University. I mean, it's not, this isn't like some secret military document, you know, it's like pretty right out there in the open. So my concern when they're starting to set up all this infrastructure through insurance, through even just the messaging of like, because so many people trust RFK. So if he's saying like everybody should have wearables, we should all be connected, you know, all of our biometric data, and of course it's for our own good. And a lot of people will jump on board because they trust certain figures, right? And you know, for the record, I don't trust any of them. They have not proven themselves to be trustworthy. And you know, what's really sad is like even the ones who may have like if we just give them the benefit of the doubt that some of them may have had good intention, they're being completely controlled because this agenda is so monumental. I mean, what was it? How much was Project Stargate? 500 billion, right? Like you can't really argue with that kind of money. It's like even if you have good intentions, if that, how do you argue with that? And how
Well,
do you argue with what that's already bought and what that's already set in motion?
why
Yeah.
don't we review what Larry Ellison said at Project Stargate? Anybody remember what he said?
With
I
the
remember.
okay, please tell us.
He said we're going to have a cure for cancer for you
That's what I thought. Yeah.
personally. He
Uh-huh.
said we can diagnose you based on your blood, whatever, and AI can spot your likelihood of getting some cancer. Maybe you already have it. Maybe you're going to get it in the near future. And he said we can also make a bespoke or a shot for you based on your genetic structure, et cetera, et cetera. We'll make a special thing for you, a vaccine that will alter your body and you won't get that cancer. Or maybe you have it and it will take it away. Okay.
This is
He nobody challenged him on that, but let me ask a question. If the AI diagnoses you as having some dread disease, maybe you don't, maybe you do, maybe you don't. Where do you get a second opinion? You can't.
no.
You can't do it. There's no place to go at that point. So, okay, so there's no second opinion. And so either you opt in to their treatment, they're gonna give it to you whether you like it or not, because you give blood and your blood will be analyzed by AI and it'll tell you, well, you have this, 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 and this wrong with you. And we recommend that you take this treatment, whatever that AI is going to present to you, and you say, not on my dead over not over my dead body. And so you all of a sudden you're put in the system at that point as being an objector, a troublemaker,
Right.
the one who didn't do what AI told them to do, and now you're going to be frozen out of the system because it's not going to give you another diagnosis again. It'll tell you're not going to get any more health care. If you don't do what we say, you're not going to get any more health care from us. This is the implication that Larry Ellison is talking about. Really scary stuff.
It's really scary. And but of course this is AI precision medicine, right? This is all
Yes,
under the guise that it's
exactly
being
so. Exactly so.
tailored
He's
to
saying
you.
that's right. He basically saying AI can make any possible genomic solution for you personally based on your DNA, your body functions, your messenger RNA, your body's proteins. He's saying we can make a one-off vaccine for you for whatever ails you.
Yeah.
And it won't stop with cancer either.
No. No. And this,
Well,
I mean, this initiative was launched under Obama. He had a precision AI initiative. This is why when, when RFK kept talking about MAHA, I was really warning people that I think he's just trying to launch AI precision medicine. This was before Trump was elected. But this was, it didn't get brought forth under Obama, although they did, yeah, there it is, the Precision Medicine Initiative. But what did launch was the Brain Initiative, right? That
That's
was,
right.
and that, yeah. And so I think the combination of the two really lays the groundwork for a more public facing biodigital convergence.
Exactly. So first we had the genomic project, the
Hmm.
human genome project in the 90s.
Yep.
And then came the brain project, and he said at the time, this is more important than even the gene project to map the human genome.
Right.
Together now, you have a complete profile of the human body with genomes on one side, mapping the human brain on the other side. Unfortunately, well, fortunately for us, I guess they haven't really got anywhere. They understand a lot about how the brain works, but they don't know how the mind works, so that they're completely
Right.
clueless at this point. But
Mm.
nevertheless, they're digging into it, all predicated on NBIC type of technology, convergent science. That's neuroscience, information science, chemical, etc. So we see this thing that they're trying to crack the nut on humanity. If they ever get to that point where they're sure they have it, humanity is going to be kind of over in one sense of the term, and we'll be all squeezed out of the system at that point. If you don't like the health that you're getting from them, you're going to have to go find a doctor who's willing to throw all of his electronic files away and treat you just one-on-one. Hopefully there'll be somebody left to do that, but yeah, I don't want to suggest the witch doctor for sure, but it's just at this point the witch doctors have turned into the medical profession.
Right.
Yep. Well,
I think
Yeah.
and
So
it's
can I?
this,
yeah. Go ahead.
Oh, go ahead.
oh, I was going to say, so firstly, so the Brain Initiative, they're very invested in studying Lenin. You guys heard this? Like they've like assembled, like they saved him, and they've like tried to assemble him, and they're doing all these studies. The Brain Initiative, which is very creepy and bizarre to me. It has not manifested into anything of real substance from what I know, but I mean maybe it has, and I just don't know about it. But I've done a little bit of searching, and I can't find anything at least public facing. But there is what you're talking about, the NBIC. The document is nanotechnology, biotechnology, information technology, and cognitive science. And this is converging technologies for improving human performance. This is long before the human augmentation document, which was, I think, I don't know, it was 2020 or 2021. The UK put out their human augmentation document, which was a warfare document, but a white paper. But this was June 2002. And I think they actually did one a year before that. But part of it is this whole, like the cognitive science is basically brainwashing people. So, um, I don't know which section it is to find it, but that's essentially what it is. The other parts are obviously very they are what they sound like: nanotechnology, biotechnology, and information technology, which is this is a synthetic biology, and with organic biology, right? It's the convergence of the two. But they're using cognitive science, which is essentially cognitive warfare, brainwashing, in order to be able to bring this to fruition. So
Exactly, and we might remember that NBIC started around 2000. as a
Well, this
discipline.
document 2002, but there's one a year earlier that was 2001. Yeah.
Yes. So that's where it started. There was no call for convergent science before that, like in the 90s, even though they were rubbing shoulders with each other, but it wasn't formally defined as a kind of a separate discipline at this point. NBIC. That's where all the trouble started, I think, when they got
I
together and they figured out, hey, we can work together here to get all this stuff done. And how many things have they messed up along the way? Holy mackerel! Genetic editing, for instance, that's just running amok everywhere.
Yeah, well, so when you were talking about like the Human Genome Project, which actually, I mean, the amount of money they put into it really didn't amass to very much. So they actually didn't discover nearly what you would expect that they would. And even with CRISPR technology, what they can do is they can delete, but they can't like edit, right? That's what they want us to believe, that they can do all this like genetic editing. They actually can't. They can do genetic deletion, which is problematic. I'm not saying that that's not concerning, but although research is being funneled into it, there's a lot of hubris in here because they want to have this. They think they can create these essentially transhuman technoplastic beings, but they actually don't know nearly as much as they'd like us to believe that they know. So I think that's the hope. The problem in that is that it doesn't stop them, and so they make tremendous blunders along the way, which are catastrophic.
Yes,
So
yes. You might remember a few years ago, there was some cases that surfaced in the news where people were getting allergic reactions from eating corn chips, like you buy in the
mhm,
store, right? And all of
yeah,
a sudden, people got these horrible allergic reactions, kind of like nuts, but based on the corn chips they were eating. Well, come to find out, the corn chips were being made with the GMO corn, and
yep,
the people who made that GMO corn said, "Oopsie, we screwed up a protein and that corn, and then it was harvested and it made its way into these corn chips, and all of a sudden people were practically falling over, in a lather. Some died probably, but that's an example of a genetic project gone wrong. They just didn't know what they were doing in the first place. Otherwise, they would have done it. This is
yeah.
everywhere. I mean, all of these
And now
people, all
they.
these.
So, no, continue. Yeah, sorry, I didn't mean to cut you off. Continue.
Well, I just gonna say all of these people are overconfident. I don't care if you're AI programmers, medical people, uh, genetic scientists. I don't care who you are. If you're overconfident of what you're doing, you're going to screw things up. And we see this at every turn with these people. They've just, if left to themselves, they'll screw the whole world up eventually.
Well, and they're going to do
Yeah.
it faster now, Patrick, because today Google just announced the quantum team developed a new algorithm called quantum echoes on it to a quantum processor called the Willow chip that achieved a result 13,000 times faster than a classical supercomputer. So if they weren't doing it, they're going to do it even faster now, right? And so what they say here is today's demonstration of verifiable quantum advantage highlights our persistent efforts, but we remain aware of the numerous challenges ahead. But they're saying they can go in and molecularly simulate tasks beyond what they've ever been able to do. So this kind of ties in with the AI. I think the quantum computing is kind of being left out of the equation here, and how scary this actually is. Because back to what we were talking about before, if you're trying to get a second opinion or you don't agree with the evaluation that's been given to you, are you really going to what are your chances of fighting against a quantum computer that's going through 15 quadrillion simulations, and you're going to sit there and try to argue against it, even though you might be right? You might know your own body better than this, than the quantum computer and the AI and the data. You don't have a chance. Can you imagine standing out in the public square saying, "I don't agree with that Willow processing chip"? you're quackery, right? You're thrown in the quackery camp, you know?
Yep. Yeah.
Well, I was going to say with the corn, there's almost no corn in the United States that's not GMO. And actually, wasn't Trump trying to sell our corn to South America, and they wouldn't take it? They're like, no,
Yep. Exactly.
we're not taking your GMO corn.
Yeah.
And then to speak to the allergy, remember, I don't remember who it was, but at the WEF, they did like some sort of like one of their symposiums, and one of the guys was saying that we can just make people allergic to meat, and we can create
Hmm.
like a tick that would bite them to give them,
Yeah.
they call it alpha gel is the
Yep.
allergy,
Yeah.
alpha gal. And now we're actually seeing this, and that tick is like spreading through California now, and a
Yep.
lot of people are developing this allergy. But it was a few years ago where he was saying, oh, no problem, we can just do this. People don't want to become vegetarian, we'll just, make them allergic to meat. And here we
Well,
are, that
this is part of the One Health agenda.
initiative. Yep.
Exactly. Using insects and other things in the environment to affect your health. Crazy.
Yeah. It's just terrible. And the irony of the whole
But,
thing is that
but
this is not beneficial to the planet. This does not
let,
help animals. It does
yeah,
not help the planet. It certainly did not help humans. We know that, but they don't seem to care about us. But
exactly. And I'll give you a tidbit from the past. But I had a farming background, so I know a lot about farming. But Monsanto, when they completed all their studies and their genetic modification of the corn, the Mexicans didn't want GMO corn. They had their own private seed stock that they had developed over generations, right? And they were proud of their seed stock. Well, Monsanto couldn't sell it to them, so they figured, oh, let's just give them free bags of seed. So they all of a sudden seed shows up with some with Monsanto on it, some not, but they distributed the seed, gave it to the Mexicans, who really just didn't. They were careless, and all of a sudden they found out, oh, these seeds got mixed in. Now we're growing them. We don't want to grow them, but now we have no choice because our own seed stock is polluted, if you will. This was dirty tricks galore. Absolutely amazing.
that is, yeah, that's really dirty. That's terrible.
It really was.
Wow.
But that's Monsanto. This is where when you have the profit motive behind you, it always ends up wrong for the people, for sure.
Well, it's not just profit, because these are these mega conglomerates who have so much power, right? It's not like a mom and pop who's trying to make a living, So you give them a profit incentive, they're going to work harder, but they want to please their customers because, they probably know them by name. Like, it's not that kind of situation. This is for profit that has a supranational kind of power, and that has connections with these NGOs, and in some cases governmental organizations as well. So that's, yeah.
Well, I wanted to say a couple of things. One, to Craig's point about supercomputers. So this new announcement by Google, what did they say it was? 13,000 times the processing power of the largest supercomputer. Well, China has one that they claim is a quadrillion times more powerful than the most powerful supercomputer. And in fact, China is leading the way. So we only hear about US stuff. And in fact, if you look at the headlines, you'd think that the US is leading the way in all of the innovation. And in fact, we're behind in most places. I think we're even falling behind in AI. There have been some models that have been released within the last week that are open source, by the way. Ironically, China is more open with their AI than we are, which is
The data.
it's a, well,
I
it's
think that's
but
fine.
but these are open source databases. But no, these are open source AIs that you can download locally on your computer. These things aren't even connected to the internet. So that it's mind boggling how I don't know, I won't get into the details there, but here's the thing for me. So AI, and I use AI a lot, and experiment with different models and everything. And the issue is it is really powerful, and it's getting more powerful, and they're getting to the point where it's able to solve more. The fundamental problem with AI in healthcare is that it's the focus on rationalism versus empiricism. So once again, they're going down the one path which says we are just machines and that there is nothing inherently useful or even that can be understood about humans other than by looking at it as a machine. And that's where this goes wrong in a material way. And so that's what all these AI systems are designed to do, is to treat us as a machine. Now, if you took the other approach and you tried to use AI as something to kind of assist us, but to elevate the body's innate wisdom, you'd have completely different outcomes. And this is what's frightening about it, because none of the big tech people are looking at it in any way other than this purely mechanical, mechanistic approach.
Yeah, I actually firsthand know people who have used AI and it was able to help them like find a diagnostic for very serious illness. And then they were able to bring that and get, they were very fortunate. They were able to get treatment. But so that's an example of, somebody who was really digging and they were doing a lot of, root cause type of trying to figure out, be their own doctor and be their own advocate, and it ended up being very helpful. But the doctors that they were seeing, and this was somebody who was seeing a team of doctors, all missed it. So this is an example of how it could be used if it was a integrative kind of process where somebody who is really leveraging it and using it as a tool to help aggregate information, that where we're seeing all these doctors completely missed it because they're almost mechanistic. They're almost operating like AI now, where everything just fits a checkbox. They're not looking at you as a human. And I think that's only going to exacerbate when they start training with AI, or when AIs replaces
Well, when
humans. I mean,
and the big issue with this is, what is the AI model itself trained on? That is the whole shooting match. And so what you find is, so I'm using Mike Adams' Enoch AI, which you can download on your own computer, and it's completely different results. I mean, it's
it
not even
is.
close. And but what I've been trying to do is I've been trying to take his information and create an interface where people can type a question and it'll actually come back either as an avatar or will actually speak back to you the answer to make it more intuitive. Well, as I've been building this, I'm using different AIs to try to maybe change the tone of the text or to put it in a certain voice. I tried to use Claude for that. I tried to use a different AI to actually create the avatar. And what I have found over the course of today is that I couldn't generate the image or the avatar because it was blocked, because I was talking. Because of course I had to test it, and I was asking, about certain, health conditions that begin with the letter C, and so I was getting blocked. So I was able to pull the information out of Mike's AI, but I couldn't even get it into text format or video format. And so this is what we're dealing with. It's the control over what data are the AIs even being trained on. And I can tell you that just from experience trying to use these things, it's not good news in terms of the more popular OpenAI, even Grok, and Claude. These are not trained on alternative data sets. This is all the same rationalist stuff. That's what it's trained on, period.
Yeah, absolutely. I'm really curious to see. I've played around with Mike's Enoch a little bit. I'm curious to see as it grows. Right now, it does give you very different results. I typically will go to multiple AI and compare them, contrast them, and see what I get. And it does give you very, very different results, which is great. But I find that it's very brief. Right, like it doesn't go into a whole lot of detail. It gives you almost like what you would get when you if you did a Google search, you get that AI overview, which is really like a short snapshot. But I'm guessing
Yep.
that's because it's really new. As it gets more information, I'm curious to see how that'll evolve. But it is
Andy
really
doesn't
different.
Andy doesn't have $1 trillion to put into it like this, like the technocrats, right? I think they've spent about $1 trillion now on the AI, and I'm sure Mike doesn't have that kind of money at his fingertips to spend.
He
So they don't
spent
have the
2 million of his own money.
yeah.
Two
Yeah, it's
million on it. Yeah,
yeah, it's a significant expenditure. Yeah. But again, it
yeah,
pales in comparison to what some of these others are
sure.
doing, and yeah. So I just wanted to throw that in there. It's almost not a fair comparison in some senses. Yeah.
No, that's fair. And what he did is incredible. It is really
Yeah.
different, and it does give you very, I want to say unbiased because everything has a bias towards whatever it's been programmed, but whatever it's been fed in, right? That's what it's feeding off of. That's what it's what's input output. That's how AI works, but it's operating off of very different data than what a lot of the other ones that I've experimented with are. So. Yeah, so it's great. If nothing else, great just to get a different angle, right? Because a lot of the other ones are running off the same metrics. Even, I think Grok was like positioned that the marketing was that it was going to be like the non-woke AI, but it's a lot of what it's running off of is actually the same data anyway. So it's not all that different.
Let me ask a
Yeah.
question. Do you guys get concerned that we know with search engines, we know how they made money, right? It was advertising in there. These things I don't think that's the way they're intended to make money as advertising. And you have to question that because they give us this AI. Let me just phrase the question and then let me give you an example that I see in the markets with the speed of how fast things are moving. So if they're not going to get paid on an advertising model and we don't really know how, and they're spending, they say 1 trillion, and then you hear numbers of 3 trillion, 6 trillion, $7 trillion to be spent, in the next 5 to 10 years, whatever it is. And then of course, the energy and all the other things, we don't know how that's all going to happen and be paid for. But number one is like, what's their revenue model? And do they almost even care? Because are they just going to do some sort of a takeover where it's really not about revenue? You know what I mean? Like, that's one thing I question. Like, if they don't have a revenue model and they don't know how they really can't explain how this thing's going to produce revenues to pay for the $1 trillion being spent. And then the speed in which these markets move, it's so fast that this is going to sound crazy, but there's 8 billion people in the world. And when I'm trading and I place an order, you're talking about they'll pull orders so fast, okay, that you'll put an order in there and literally it's about 20. So I let's say it takes me, a half a second. That's 500 milliseconds. And then it takes 30 to 50 milliseconds to travel to the exchange. And then they're able to interpret that data. And probably by the time it hits their servers and everything else, they can make decisions for about another 500 milliseconds. So we're talking in under a second, they've already made multiple decisions and they can pull that order before I even see it hitting. The things I see going on in these markets is just absolutely absurd. So the reason I say that is, and I mean, I could point out examples all day long of like how sensitive 8 billion people in the world, and I'm one person placing orders in the markets, and they're able to pull these orders that fast. So reflect this back onto this AI. Maybe they're going to give it to us and it's actually legitimate up front. But the problem is, think about how fast they can change that conduit, that system of the data flowing back to us. If that's how the markets are operating, think they might give us something now, but they can take it away from us in 500 milliseconds. You know what I mean? And they can even alter it somewhere down the road.
So, okay, there is a Black Mirror episode where the girl had like I think it was a car accident and she has a brain, or maybe it was a brain tumor. I think it was brain tumor.
Yeah.
Any case, she basically dead, and they say there's no hope for her. Like we're pretty much gonna have to pull the plug, and then someone comes and gives them, well, we have this new technology, and we could essentially they hook her up so she's got like a computer interface to insert into part of her brain to make her seem human again. And so at first she's up and running, and I know this is fiction, but this goes exactly to what you're talking about. So the technology is called Rivermind. And at first it's great, but they say there are a couple of caveats, like you can't go out of range, like if you go outside the connectivity area, you're turned off. And you need more sleep. So like if she didn't get enough sleep, because that's how they power this whole system is while she's sleeping. And so she has to sleep a certain amount of hours. Anyway, she's going about her life. She's a teacher, and she's they're going about their life, and then and then all of a sudden she starts to need more sleep, and her ranges get shorter. Like she can't go. They wanted to go somewhere for their anniversary, the couple, and it was slightly out of range, and the whole thing shut off. And so they said, "Oh, no problem. You can do an upgrade." So this ties into, this is a healthcare device, right? They're incredible technology where her brain's going to function again. She had a tumor that killed her, but now she can function. She seems completely normal, has her whole life back. This is incredible. But she can't step quite outside this range, and she can't sleep for more than a certain amount of hours. And so they do an upgrade. And now she can go into further ranges, and you pay for this upgrade. And then all of a sudden, she starts reciting ads. She's like in school teaching, and she's reciting ads, and they go back in. Well, what's going on? They start to catch on to what's going on, and they said, "Don't worry, we have an upgrade for that, but the ads won't shut off unless you do the upgrade." So all this just to bring up, I know it's a fictitious, Black Mirror episode, totally dystopian sci-fi, but to your point, Craig, yeah, they can absolutely give it to you. I think they want to give us all of these technologies now so they can collect all the data, but they can always change the contracts. They're constantly changing, right? The click wrap agreements. They can change that. They can make it so that we have to pay for it. They can increase the prices of it. We've already seen that with X. They've already changed the various models, and what you can get for so much. And there are different tiers, right? Just like Rivermind, you have the one tier where you're reciting ads all day, and then you can upgrade and not be a walking advertisement. So
To your point, Craig, Sam Altman himself says there will be no profit until at least 2029. That means he's going to burn through $160 billion of cash until he gets profitable, and maybe never. The whole industry is built on a house of cards right now, probably because of Sam Altman. He's a consummate promoter for sure. He's not a programming geek, but when he makes his predictions, how much money he needs. Oh, we need trillions of dollars to build these AI data centers. Oh, we need $1 trillion for our new development project, whatever. Well, they're not producing the results at this point. Even with OpenAI version 5, they had a lot of heat already, and you can see 6 is gonna come out at some point, and people are gonna probably bash that to death. They have no new breakthroughs. So here's my question: Is this bubble going to pop at some point, a financial bubble, based on AI in the first place? That's first part of my question. Second, all these companies who have been embedded with AI, from Amazon to insurance companies to lawyers, law firms and accounting firms, you name it, all the companies that have been adopting AI based on some future measure of performance, they're saying privately now they're not getting the ROI. And they're questioning, did we make a mistake? This will come out at some point, especially when the bubble pops. What's going to happen to society at that point when all these companies, including the medical offices and the AI diagnosis and all that kind of stuff, when the bubble pops and people start realizing in the industry that they made a huge mistake and they have to unwind and hire some people back, what's going to happen? What's the landscape's going to look like at that point with this, when this financial bubble just goes kaboom?
Well, that's a great question. And here's the thing. I think what we're doing is we're playing a very high speed, high powered, absurd game of the emperor has no clothes. Okay. And, you know, again, 13,000 times the fastest supercomputer. The things I could show people that go on in the markets would just drop their jaw to the ground, the speed at which this goes. But in the end, you know, they're trying to, we see this circular reference, right? Just to give you a quick example, you know, XAI buys NVIDIA chips. They don't buy them. They lease NVIDIA chips, right? NVIDIA takes the money, they give it back to XAI. XAI takes that money and leases more NVIDIA chips. NVIDIA then loans them more money. XAI buys more chips from NVIDIA, and it goes round and round. It's a circular deal. It's a little more complicated than that, but that gives you this idea that it literally takes someone like Aaron, right? The kid who calls out, hey, look, the emperor has no clothes, and we need to get on another another network before this thing completely blows up. You know, we need to set this system up on our own healthcare system on another network. And that's really, in my mind, the only solution at this point is to get off this game of the emperor has no clothes, this high-speed game of the emperor has no clothes, and go somewhere else, right? Where we actually can be sane and think and actually set up real human-to-human interaction. Because if we don't, it is going to pop, like you say. The problem is, though, who's going to enforce it, right? I mean, these guys are in the Oval Office, right? It can't get any more mainstream than that. Like, the SEC is not going to do anything. You know, the CFT, no, there is no enforcement agency. It is the Wild West, right?
Do you think that there'll be a financial bust like there was in the dot-com bubble, or even in the real estate market in 2008? Is this the kind of bubble that they're building at this point?
So I have a different take on this, which is that, and I was in the dot-com bubble. So yes, there was a dot-com bubble because there was a lot of malinvestment and a lot of ridiculousness, but it completely transformed the economy. Everybody used Amazon. Everybody uses Amazon now, and these are multi-trillion-dollar companies that came out of the dot-com era. I don't think what we're experiencing right now is a bubble at all. And by the way Silicon Valley works and the way tech CEOs work, and you can see this, Peter Thiel talks about it in his book 0 to 1. Musk talks about it. Their entire strategy is, if you're going to get into a market, you go for monopoly control. And so it's an all-in situation. So the people that are investing in them know, look, yes, this is a moonshot, but you know what? If we win, we end up being like Amazon. So while most things will lose, the ones that win will win so dramatically that it's worthwhile for the people that are making the investments to make the investments. And I actually think that the AI productivity improvement is amazing. And I've seen this just playing around with it myself. And again, it depends on how you control it and everything else, but it is going to be the automation of processes. There's a book written called Life 3.0. And if you can actually get to AGI, what you're going to have is the creation of organizations that are self-running. And this Life 3.0 talks about an AI that evolves and then creates its own media company and actually creates its own movies that are all AI driven. And then it takes that money and starts investing in the stock market, and it kind of walks through a scenario. But this is the psychology of how venture capital has worked for decades. And so everybody's in a race. So you have Meta. So everybody's trying to figure out who's going to be the one that's left, because there aren't going to be. So certainly most of these are going to shake out. But the one that doesn't get shaken out is going to have literally the ability to create autonomous running companies that run industries. I mean, that's actually what's at stake here. And it's very real. Like, the technology is real.
Elon talks about that, right? He's like, his robots are going to build robots. Yeah. His robots are going to build the cars. He talks about that all the time.
Yep.
My big concern is that even though some of it might be a bubble, and I know people have talked about that, and I agree with you, Aaron, that even if it was a bubble, there are ones that will survive, and those will be massive. My big concern is that I think they know that there's a window, and they're trying to exploit as much as possible to put everybody under as much control as they possibly can during that time. And I think, and this is speculative, I mean, I can't prove it. There's a lot of evidence and data points that are pointing in this direction, but I mean, I can't prove it. But I think that this whole stablecoin, digital currency infrastructure that they're trying to push, and this AI precision medicine, I don't think they're separate. I think that, that patent that we pulled up on the screen, that 666 patent that I know back in 2020 we were all called crazy conspiracy theorists for talking about. But I've been on a show on that patent, and it's actually very extensive, and there are links and links and links. I mean, it's not just that little abstract that a lot of people point to. And when you start going through what it is, and I know a patent isn't always evidence that it's being utilized. However, I think a lot of this infrastructure is in place now, and they're talking about cryptocurrency using body activity, right? So I think they're trying to create an infrastructure now where they can collect as much biometric data as possible, and where they can tie that to some sort of a digital currency infrastructure. And then they can use that as some sort of like, one, it can literally power it. They can do crypto mining that way. But two, they can also control you. They can, based on your biometric data, they can. I think it serves many purposes. Like the data is the currency. It can be the data is the new oil, as they say. I think that's part of it, but I think it's also this cybernetic feedback loop where it does become a complete control system, and that's my concern. I don't think they're separate. I think right now they look separate because they're building the infrastructure. But if that is the case, then yeah, they can make a fortune off that, and they have complete control. They have complete control. They can depopulate. They can, make it the schism between it becomes a neo-feudal society completely.
Well, I think
So
what Patrick's asking too is what's the fallout? So what's the fallout from something like that? Because, we see gold going up the last, what, 2 or 3 months, and it's going up like crazy. And I kept saying, look, we're going to see a day where we see 6-10% sell off, and it's going to come really fast, and we just saw it, yesterday and today. And it's going to be the same kind of a thing, right? There were professionals out saying, this it's done, right? Or they were saying it's not, this is different than every time before. It's really never different. This will have similarities to the 2001 bubble where things crash. The difference will be, will there be a Federal Reserve who can put the pieces back together? Okay, because one company might win, or maybe a group of them win, or a little oligarchy, or a monopoly or an oligarch of some type wins. Maybe it's not just one, maybe it's a couple of them, and they team up because these guys are all teamed up, right? Remember, these guys aren't too distant from each other from the PayPal mafia. Okay, so it's a question of who's going to stab who in the back here, really, in the end, because somebody's going to win and have the technology, and will they? This could get really ugly. But the point is this: that I think there will be immense fallout at some point because there's been a lot of capital put after this, and there's still a lot of capital to be put after it. And what will be the fallout with the energy companies, all the other this is going to have a trickle effect. It's going to be massive. Even if we get that one survivor, or that 2 or 3 survivors, what's going to happen to everything else that we know on planet Earth in the meantime? You know what I mean? And so if we don't have the ability to transact human to human, like it's going to get, I think it could get very ugly when the thing does pop. Whoever survives, yeah, I don't know what it looks like on the other side, but I do think there will be, I think it's a combination of what Aaron's saying and and the question Patrick's asking, that it, things do the same thing. Markets get overvalued and they will crack. You know what I mean? And the fear, it still comes back to fear and greed, right? In the end, it still comes back to fear and greed until they can find some way to override that with, this is what you're going to do. And if you don't like it, we can control you. Okay. I think that's really, they got to get over that
That was
hurdle.
what I was getting at, is I think they have a limited window, and that's why they're
Yeah.
trying to, because that's where they can control you. And
okay,
fear and
we have on one hand we have the possibility of a bubble, a massive financial bubble that would take a lot of hubris with it. And then we have the possibility that these people, you can see some of the desperation, for instance, in Sam Altman's face when he talks these days. He's a man I think is really possessed to drive forward regardless of the cost. And so if they figure that they have all the marbles in their pocket and their bag right now, and they're going to go for broke, they may only have one chance. But if they're going to go for broke, in other words, they're all in at this point, and they can see the end. We can't see it necessarily. We're hinting at it, But if they see the end of this is total domination of society, this may be their time. They're going to do it. In other words, what they say in the movie, naval movies, damn the torpedoes and full speed ahead.
Yeah, I mean,
Right.
I think when I look at who the players are, the funny thing is the dominant players are the same dominant players that have been dominating tech for decades. I mean, so you're ending up. So Google was by far the leader for a long time in AI. And let's look at where is Google? So Google, they're supposed to be releasing a new model as early as this week, which may be the new groundbreaking model. So they decided they got complacent, and they had people that were making $300,000-$400,000 a year and coming into the office 4 hours a day, if that. And so that happened. And then when Musk got involved, they went all hands on deck. So you have everybody now competing, but these are businesses that have they're not singularly in this AI space. Google, for example, they have cloud infrastructure for 30% of all the healthcare data. Microsoft made some acquisitions. They acquired a company called Nuance, which records every single doctor visit. And they host Cerner, which is the electronic health record system. And then you have NVIDIA, which of course is providing all of the hardware for all of this. But on top of that, because I actually bought an NVIDIA, it's a small supercomputer. I don't even call it a supercomputer, but I've seen how their ecosystem works. And so they have so many different ways of making money on this. I think where the bubble is going to be is actually in the data center area and in the energy area related to this. And I'll explain why. So much of this arms race has been that we need all of this computing power, and that's why we need all of this energy. But they didn't factor in that even within AI itself, there's going to be innovation. So just yesterday, there was an innovation in how data is trained that's going to reduce the energy consumption by like 90%. So I actually think you're going to see efficiencies, and that those efficiencies are going to be problematic for people that invest billions of dollars making assumptions that you're going to need data centers and certain amounts of hardware. So I think it's, again, but I think what we're going to end up with is the big play. We're going to have, Bill Gates and Microsoft. We're going to have Larry Ellison, and we're going to have, Peter Thiel and Elon Musk. I mean, and these are guys that have empires that span far more than just AI. AI is just the accelerant to everything that they've been working on from a technocratic perspective.
For sure. Yeah, we just have flashed up on the screen about the Ford cars. And I think I brought this up on one of the other episodes, but I was totally speculating at that time because they had this it was kind of like a like meditation technology that they were testing. But now they're actually saying, and this was actually a few years ago, I didn't know that they actually did a brain machine interface system, and they're working on it with autonomous like self-driving cars, which I mean, then talk about, like, again, control, right? If they can do remote brain interface and the car is driving you, then they can control the person. They can also decide not to drive you. They can go somewhere that you don't want to go, right? This is I think what's happening is all of these various whether it's the AI, these various tech companies, the robots, the cars, they're and the infrastructure, right? So the economic structure that they're setting up, the healthcare structure that they're setting up, they're all trying to coordinate so that they can have control. So if people don't, so like if there is some sort of a fallout, then they'll force people, but they have to get enough people in at the moment, I think,
And
is
they've
kind
got
of
more
what they're.
people in because we don't even realize we're in. We're in and we don't even know it. For instance, like with the claim system and some of the other stuff that's going on with electronic health records, that to me is the most startling, is to try to get out the examples of where, hey, again, we're not talking about something that's not going to happen. Did you realize this is already going on with your data today? Do you realize that this is what's going on with insurance claims? And if I had to make a prediction, and I'm sure these will be wrong, but at least it'll be recorded. But my guess is that Anthropic will be acquired probably by Apple, and that OpenAI may be acquired by Oracle, and then we're going to end up with these big AIs all under the control, all controlled by companies that have $1 trillion plus market cap. And I think that's where this is going to end up. And I think it's going to move there fairly quickly.
Yep.
I
Well,
I,
and
I think that.
XAI and XAI, right? That's one of those three, right, Aaron? Because
Which one?
if you break that down again in terms of those three again, so you have XAI, which obviously gives you Starlink, Optimus,
Mhm.
driverless cars, gives you all that. Then you have the Oracle, and who did you say with Oracle? You would think
Well, I think Oracle will OpenAI. I think Oracle will end up
with OpenAI.
folding OpenAI. I don't think OpenAI
That makes sense
stands
because there's
alone.
a Stargate
I think at
relationship.
some point, because of the Stargate relationship, but
Yeah,
again, I for some reason Ellison fell off my map, but I mean he is just everywhere
yeah,
now,
Blue.
and
Yeah, he's everywhere.
so I suspect that's where. And then Anthropic, I think Apple will possibly
Apple.
buy Anthropic. So
Okay.
Apple has not been a big player. There have been discussions about, I think Tim Cook is going to leave the CEO role. And so they've lost out on AI. They at one point had talked about doing a car, self-driving car or an electric car. They didn't do that. They haven't innovated that much since Steve Jobs. They've done a great job of incrementally improving their products and making a lot of money. And so they've had some fits and starts in AI. So my guess is they'll buy somebody like an Anthropic, because Anthropic's going to have a hard time because they are burning trillions of dollars. Okay, you can actually you can be an Apple or a Microsoft, and you can actually burn that amount of cash until you get profitable. Amazon wasn't profitable for I don't know how long. I mean, it was the joke during the time, because I was in the .com thing, and I would meet with investment bankers and everything else, and so I mean the whole strategy was, yeah, they're going to lose money on transactions, and in some cases they had negative gross margins. But the theory was, if you basically can buy up enough market share, then at some point when you do turn profitable, you will be basically the owner of the entire market. And that is in fact what happened with Amazon and not everyone else. But that strategy has turned out to be somewhat effective. Now I will say
Yeah.
the AI companies do make money. I mean, yes, they charge subscriptions, but where they make money is they charge for APIs. So I pay a lot of money. So so people that are using AIs for coding and for other applications are actually paying. So they do have revenue streams. And so, I mean, at some point, are they going to decide, hey, we're going to increase this by 3x? I actually view this in a way as kind of a golden age, in that I know what I'm using right now, I'm not going to have access to in the future. It's kind of like the early days of even search engines that used to actually provide results, right? It's like, okay, I know right now they're losing money every time I use this, and so I'm trying to build as much as I can, knowing that they're either going to have to increase the costs, or some of these companies are going to just go away entirely.
Yeah. No, I think
Well, and
that's right.
also, I think it'll be similar to what the search engines did, right? Like the access that you have will be limited, right? The
Yep.
the search engines now are so compared to what they used to be, where you could actually search and find things. And now it's just like it's all algorithmically driven and usually not stacked in your favor. So
Yep. And it goes
Yep.
back to the haves and have-nots. If they can throttle you as fast as what I see in the markets, within 1 second, they can make 25 decisions to throttle you. Think about what they can do on this. They can read your input. What have you been doing lately? Are you being good? Or are you being bad? And they can throttle you pretty quickly, like really quickly, within seconds.
Wow. Well, I saw something yesterday in my feed where they actually had a contest to see which AI model did a better job trading, and I can't remember which one it was. Maybe it was Grok or DeepSeek or whatever, but did 10% return in one day, and they were comparing the different models. So, yeah, so if somebody does turn out to be the big winner, and they have train their AI on more data, and they've kind of come through victorious, that organization has a massive amount of power and control, and likely will not use it for good purposes based on who the players are at the table.
So I have a question that's I mean, it's kind of speculative, but they did admit that the shots were, technological bio warfare, right? Um, so what do we think the chances are moving forward with all this precision AI and they're using technological kind of injections, that there will be some sort of forced um I don't know, that then the nanotechnology will become more pervasive, and that a lot of this will be done under the auspices of they're doing predictive diagnostic, right? So they can now tell you, and you may not really have whatever that is they're predicting that you might have, but you will need this solution, of course, and this solution might have all sorts of non-organic material. What do you think the chances of that increasing? Because I think it's already happened, but that, yeah, that chance of that increasing and where that might go.
It's going to be ugly. There, there was just I just had an article this week that I posted on technocracy.news,
Hmm.
and see if I can get this article up here.
Yeah.
Ba, 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 ba. Let's see. I'm in the wrong direction here. Shoot. Yeah.
Okay. Oh, there
Okay,
we
here we
go.
go. This
Yeah.
I'm looking at this article here. The International Judicial Authority declares
Mm-hmm.
mRNA injections are biological and technological weapons of mass destruction. This is an
Mm-hmm.
interesting story for sure.
Yeah.
But one thing it underscores, there's a group of people now increasingly looking to mRNA, especially as containing not just things like to build proteins, but also other technology embedded in as well. And they're not specifying exactly what that is,
Sure.
but we've seen a lot of studies now that are suggesting what it is. My guess is that some of the experiments during COVID, um,
Sure.
2021, 22, 23, probably some of those experiments failed, but they told them enough to make the future rosy for them to perfect their technology. So probably you're going to have more injectables in these shots going forward. You may not know it. You may not have a consent form presented to you, but the likelihood at this point is going to keep on keeping on.
Yeah. So, during that time, we had Charles Lieber was convicted of essentially they slapped him on the wrist with like tax evasion, and I personally think it was really an espionage case, but that's not what was that's not what came to bear. But his technology, he's partnered with Elon Musk on the Neuralink. He's the one who patented the neural lace, and all of his research was nanobot technology. And he was the one who patented the injection for self-assembling nanotechnology, essentially self-assembling robots that could be injected, and that would have that would be like a essentially like a binary weapon where there would be a delayed payload. um and I think it's interesting that he was part of that Thousand Talents plan with China. Harvard owned part of his house, and they were doing the Wuhan Libre lab. It's quite an interesting story, but I think it's interesting that they gave him a slap on the wrist for taxes when really I think he was largely and Langer as well instrumental in developing this technology that I think there's evidence now that many of us thought at the time, but I think there's evidence now that's coming to the surface that there is some sort of technology and that this could be only advanced, I think, in the future. Now they're talking about like 9 months old needing to take these. You would think they would have rolled back on all of this, but they're actually moving forward more aggressively. And we still have Trump saying that he's so proud of it. Like he has not really walked this back. You have your choice. You have your choice. It's he says that, but he hasn't really walked back on all of it. And you would think that with MAHA, which was really supposed to be Make America Healthy Again, I think a lot of people thought was about taking ownership and having the government get out of the way, right? Not poisoning us constantly, and then people taking ownership of their own health. But it seems like it's very much the opposite. Like they're ramping this up, and that a lot of these theories that people had are maybe not so theoretical.
Yeah. Well, and I think all of us on this panel would say, that that this technocracy has really picked up speed in the last year. Okay, moving really fast, maybe 2, 3, 4, 5 times as fast as maybe it was. And so if that's the case, and we look at the political situation, we go through, back and forth, right? Through the 90s, early 2010s, you get Bush, then Obama, then you get Trump, right? Push, and then you bring in Biden, and everybody's begging for something to happen, right? You're watching this guy in there and you're thinking like, where's this country going? So you're begging for something to happen. Bring in Trump again, and now what does it do? It allows this, it's almost like welcome. Let's do something, right? So now you push forward and you start pushing and pushing and pushing, and no one's going to stop it because they wanted to see something happen. So as long as they see something happening, we're blowing up boats coming out of Venezuela, or we're starting this, or this war is getting settled, whatever. People see things happening, and yet this technocracy is moving so fast. And I think, going back to this whole COVID situation, this is kind of that go for broke that we were talking about. It's like they open the gates with this COVID, okay, and they've got this whole thing sitting there. And then all of a sudden, it's like all they need to do is roll out this technocracy. And these three companies we just talked about are going to aggregate the power between all this stuff. They're going to get the power. And then they want access to whatever happened with that jab. You know what I mean? Whatever happened with all those nanotechnologies and whatever went in, are they reaching out to grab control of that? You know what I mean? Because again, the Internet of Things, right? Is this part of this whole thing that they keep talking about, the Internet of Things? Did we just basically welcome in the Trojan horse for this technocracy in this, go for broke mentality? We may have invited it right in.
And I know that was your initial question. I mean, was this by design? I mean, they've admitted it's a bioweapon, and I'll try to be careful about how I describe this so that this doesn't get blocked. But I mean, at the time, people talked about the fact that people with certain genetic predispositions were less likely to get either C or the shot related to curing it. And so, if Larry Ellison is talking about how you're going to be able to do genetically targeted mRNA, well, I mean, obviously you can use that you can weaponize that can go a whole variety of ways. And I think that probably is, I think that's intentionally the point. And I think that the fact that we're now under these executive orders, collecting genetic information on children, and we're doing it under the guise of cancer is a very dangerous, it's an incredibly dangerous thing, because the level of targeting they're going to be able to do is insane. And I do believe that, but probably not to cure, right? They're not going to be able to use CRISPR to edit things, but they certainly will have a much easier time using their newfound knowledge to target people. And that's a frightening prospect. Amen. And real, I believe.
Yeah, I think so too. I mean, I think that's part of what that is all about, right? They want to put every child up onto a blockchain ledger. I mean, they've already done this in other countries, so that's a huge part of the agenda. So I think that's that's very concerning, and I think that's part of what this biometric data is all about too. And then they could specifically target people. Yeah.
Yep.
Yeah. Amazing.
Uh, well, all right. I don't think we have too many questions. I told everybody if that I don't have access to pull it up on the screen. Next time we will, I think so. But we had just switched to a different system so that everybody could broadcast. But I told people to put it in all caps so that I can see. But right now, the first question we have was do we have any more topics? I'm sorry, I didn't mean to jump into that, but
Let's get
we
some
want to cover
questions.
it? Okay. So the first question was, what can we do to raise awareness? I think that's what we're trying to do here, but maybe and everybody on this panel is doing a great job of bringing awareness. But I think they mean the audience, like what can individuals do? Yeah, the brochure is
You
great.
bet. Here's our
Yes.
brochures, Technocracy brochure.
Mhm.
This is
Mhm.
a low level type of introduction. And well, I'm sorry, it's backwards there. I don't know. Yeah, it's backwards, but it says Technocracy on the cover, right? So this is something that people can hand out for like go to a restaurant, go to doctor's office, anywhere you can leave one. People pick it up. What the heck is this? they'll see the robot on the front serving a hamburger, and the caption at the bottom of this thing is brilliant. You wanted convenience, instead you got replaced. So, this speaks of robots for sure. But that's one way you can start a conversation with somebody. It's just a conversation starter, and you have to start somewhere. We practice Cash Fridays, and actually Cash Any Day. We take and if we're going to spend money at a restaurant, we always pay in cash. And I make sure to tell the server, you understand why I'm giving you cash in the first place, because I want you to spend this cash anonymously. I don't want to see you being tracked on your expenditures. Their eyes light up. I'll tell you what, most servers now, they don't get their tips for 2 weeks because it's all processed and the credit card bills and so on. So they're so happy to get cash and say, put this in your pocket right now, and don't let anybody see where you spend it. Basically, they get the picture really quick if you approach people like that. There's so many ways you can build bridges with people, even just like that. You can.
So someone asked where they get the brochure. They can get it at technocracynews.com, right? Yeah.
Exactly. Technocracy.news. It's on the homepage. It's in a store as well. And you can get them. I sent them out like packs of 25 in a shrink wrapped package. So
Great.
they're easy to get a hold of, and whatever, you can buy one or more. Some people are buying as many as like 10 at a shot, and they're passing them out everywhere.
That's great.
That's great.
So someone else asked, what if profit is not the motive? And I mean, I think some of them are obviously driven by money. There's a lot of money on the line. But I would argue, I think that that's a valid question. I don't think this is all profit driven. Yeah,
I want to say,
what are your thoughts?
well, I'll tell you what, I have mixed feelings on this, because what is profit? You have short-term profit, you have medium-term profit, then you have long-term profit. What are we talking here? We're not talking about investors or people like Sam Altman. He doesn't give a rip what he tells his investors six months or 3 months for now. It's not about that time frame. But in the end of it, like Aaron says, if they're shooting for a monopoly, then it's game over for everybody at that point, because then you could set all the parameters to game it for yourself, and you make all the money in the world at that point. If we end up with AI companies or tech giant companies like Amazon, who dominates the whole space, that's not about short-term profit this is for the whole enchilada at this point.
Yep. Well,
Well,
they shut down the world with COVID. Can
Mhm.
I just add one thing?
Yeah.
So they shut down the world with COVID, to the point where you could go out on a street that normally has traffic almost 24 hours a day, and there would be no traffic. So I guess the question is, do we think that they've gotten further down the road, or have they gone backwards down that road? I think the question's pretty obvious. And so what comes again if they, and we, I guess I have to be careful how I say this. I don't know, but I think that have they made progress since 2020 and 2021,
Oh.
or do we think they've gone backwards? I think it's pretty clear.
Pretty clear. They're racing for the gate right now,
Yeah.
I think.
Absolutely.
I would just say that I think that, yeah, certainly I think there's short term, long term, mid range profit, and I think literal profit. But I think there's also an element of like control that they want. I do really think they're trying to create a techno feudal transhuman leading to a post human society. And they want, I don't think they want a completely post human. I think they want enough humans that can, I think they want them to survive. They think they're going to live to be a few centuries old or whatever they think it is these days. I think I saw somebody say it was like 1,000 years they think they're going to live, but they're not talking about post-human for them, but or I guess maybe post-human for them if they merge and become cyborgs. Maybe, yeah. But I do think they want enough in the meantime to be the serfs, to collect the data, to do the work, to and to program until they can get everything up and running. I don't believe that's a reality, but I think that's their vision, right? But I think that a smaller population is much easier to control, and I think that they can, if they can control all the resources, they can dole it out. And so that, the plebeians only have access to so much and they have the rest. So I don't know. I'm not convinced that it's all purely profit in like a fiscal sense. I think for some of them it is, but I do think that there is another agenda as well.
Yeah, no, I think it's a power motive. I mean, if you look at Elon Musk, I mean, he even sold his house and kind of downsized from that. It's not about acquiring more stuff. It's entirely ideological and about the power for those at the top. And then there are others that are compliant with that because of the money. So the whole system ends up working out because you've got the people at the top driving the power and then everybody else below them trying to get a piece of the action. And so that's a great formula, unfortunately.
Well, and they're dealing in such big numbers, you can't almost even imagine. COVID cost about $5.6 trillion on the surface. And then, this guy, David Cutler and Larry Summers, who I could go on for hours about that guy. He's terrible. But anyway, they estimate 16 trillion in overall cost. So we're talking about one of the biggest wealth and power transfers of all time, just with COVID. You know what I mean? You're talking what, 10, 20 trillion dollars? Who knows what the transfer was? And I think it was more power than it was money. Where'd all that money go? Where did it go? Right? I mean, we have the debt. We don't pay anything down on the debt. We just pay the interest on the debt. But where did all that money go? That's the question. They already have enough money. I think, the money's out
Yeah.
there. It's really, I think it's more about power than it is about money at this point. Because you got to ask, where is that $37 trillion, right? That's, the debt, where did it go?
I agree. At some point, it's like, I mean, they as you said, they already have the money. So yeah, I think it is largely power driven, but the money incentivizes those underneath, right? So you start to create the tiers. And I think that is part of why it is so effective, which that leads into the next question someone asked is, does the mainstream media report on their activities, i.e. the data center development, or do they own the mainstream media too? And I think it's very similar, right? I think there is that stratification, and I think we're seeing it in the quote unquote alternative media as well. I call it the indie media, which isn't really all that independent. It's a indie, um, that kind of in between, but where they're largely controlled. And I think that there's the power, right? We saw Operation Mockingbird, the effect of that, right? That wasn't about money. That was about controlling the narrative. But who benefits, right? So they're trying, they pay off lots of people underneath and they're profit driven. And so then it creates a nice little feedback loop where the system is, very effective for them. But unfortunately, we're seeing that largely even through the independent, or as I call it, indie media too, now where and some of it's not even done directly through profit incentives. Some of it's done through algorithmic incentives, which translates to profit incentives in a lot of cases.
Yeah. I think the media is totally controlled, but here's the thing. They're very savvy in how they do it. 98%, it's like a crocodile in the water, right? They sit there really still with their little eyes above the water and they let whatever the prey is come into the water. It's the same kind of thing with Fox. It's the same kind of thing with the news wires, everything. They let you come in and they make everything look calm. This water's calm. But I watched this go on where I've watched for 25 years the media get manipulated. And here's for an example how you can see it. 2 Fridays ago, we see at 10:57, President Trump releases something on China. Okay. It's 10:57. Japan, Asia's closed, Europe's closing, and the US liquidity is drying up. Okay. So you don't do that. Scott Bessent knows you don't do that. Howard Lutnick knows you don't do that. President Trump pretty much knows that too. So the market tanks on a Friday. They could have retracted that statement. He could send out a tweet in 2 seconds, right, and send one out, but they don't. They let the market come down. Then on Sunday night, a lot of panic. People think the market's going to crash. Then Sunday night, they come out and they clear it up over the weekend. Oh yeah, everything's great with China. Market gaps higher. You can't even trade it. It opens up and it gaps higher, and the race is back onto the upside. Then they come back the next Friday overnight in the middle of the hours when Europe's open, when Europe's going strong, Asia's closed, the US is closed. So they pick these sweet spots in time. They tank the market again, right? And then what we get is then they come back in and they reannounce it and everything goes back up again, right? So you see this pattern like Friday to Friday. I saw this again in late 2024 as well, when the whole thing's going on with tariffs started. The tariffs with Canada, that started first. And then we saw the DeepSeek news released at the World Economic Forum. And so you see these patterns in the markets, right? There's patterns occur and you'll watch them. They manipulate these news wires. And it's not even, to me, there's zero dispute over that. It's like almost, I would say 99 with 6 digits of nines, 99.9999%. It's clearly manipulated, but it's very savvy. It's like the crocodile in the water, and they let the bait come in, right? They let the prey come in, and then they strike. And they strike you between the eyeballs, so it's very, very efficient. These people are very savvy.
They are very
Amen,
savvy,
yeah.
and they're. I have a friend who is actually involved in building this technology, so I know that they do this, but he didn't know it would be used this way. But in terms of funding the media, like independent media, they can make it look like it's multiple people because it's one person on these various payment systems or various credit cards that they're all anonymous, and so they like if one entity wants to like prop somebody up, but they want to prop up a narrative, they can disperse it so it looks like it's coming from an organic, they just have so many fans. So they're very clever about how they do this. So it's definitely largely controlled.
Well, yeah, and we have the illusion that it's actually free, but the thing is we now know 70% of the traffic is fake. They're bots. You have these facilities that have 10,000 cell phones that are managed by like 2 people creating fake traffic. We know the algorithms are manipulated. We know that it's pay to play, which Craig has dealt with personally. And so yeah, we can't. This is one of the ways they're hijacking our free will, is by hijacking our attention and our perception, and then doing this with the illusion that it's actually free speech. And so this is one of the, it was asked earlier, what can we do? Well, recognize that and start pulling away from these systems and start to take back our emotional sovereignty, our cognitive liberty, and our actional independence. We can all do that, and we all have the ability to do that. And that's the way out, fundamentally, in my opinion.
I agree. Yeah. All right. And I think we have a couple comments, but I think most of the questions are done. So yeah. And does anybody have anything they want to close on? And then we'll, of course, give everybody a chance to tell them where they can find you.
Well, one
Should
other
we go?
thing to measure. Can I just throw one thing in there?
Yeah.
We were talking about, once before we covered the, so 2 things. One, we covered sovereign wealth funds, and that same time one of the prior sessions, we also covered, the Optimus and the robotics and everything else. And so from this technology front, it seems to me that all the effort and money is going into the AI at this point, and probably even the quantum computing, because I'm watching the private equity funds, I'm watching the sovereign wealth funds since we did that work, and watching to see if they're pumping money into the biotech space, right? If they're going into the space. And so far, I don't see it. I'm watching the private equity stuff. I'm watching the sovereign wealth. There's activity, but not like it was. Not like we see these biotech booms like we saw in the 2020 and way back in time. The other thing too is, this Optimus, these robots, one of the things I wanted to throw in there that I was thinking about is that the human hand has like 21 to 27 different motions, right? What do they call it? Degrees of freedom, right? So the robots are now at like, I think 17, if I'm not mistaken. I think they've stated that they're at about 17. I think when those robots cross that 21 barrier, whatever it is, where it gets the degrees of freedom, because remember, that's what they say separated us from other, things, is the opposable thumb. So I think this is a big deal. I know it sounds kind of quirky, but I think this is a big deal. When those robots cross that 21 degrees of freedom or whatever it is, now all of a sudden we truly are replaceable, in many, not in every way, but in many ways, from an actual just, working human hand, type of thing. Then you have to go to the brain, right? This is the AI, the quantum computing, the decision making, and everything else like that. So I'm thinking of it in terms of actually, what a physical hand can do. Because we see these robots doing flips and things like that. That's all great. But what really matters is the little digital skills, because that's what really matters, especially in a high tech space. And you can break that down. I did a lot of work on this just to study it and see like economically and different things on that. But I think it's the battle between that and I think the human mind are kind of some these other metrics that we can keep an eye on. When do they surpass the human mind? And we've talked about that extensively tonight. I think with the if you try to go against the system, you're going to be considered a quack pretty quickly, and then you're going to get thrown on the outside, and it's going to be really hard to get back in. And so I think hopefully that helps wrap up some of the prior ones, the sovereign wealth funds, the robotics, looking at this healthcare space and where are we with things. Hopefully that kind of ties it together from for people who watched some of the prior roundtables as well. That's really all I had.
Yeah, no, thank you for that. That does tie it all. Yeah, I'm really surprised to hear that there isn't that much money going into the biotech. That's actually really fascinating to me.
Not yet, but it probably will
Okay, and
come.
not yet.
Yeah.
Well, but
Phase
the thing
Yeah,
is, but it is going into AI, and in some cases, you're now
for sure.
seeing
which
these
I think, yeah.
AI
Yeah.
software as a service or software as a whatever they call it, medical. You're getting FDA approved things that are AI driven. So maybe that's the backdoor way that biotech is getting invested in.
Well, and I think, I mean, they need to set up the AI before they can merge it, right? I think they did. I think it goes in waves, right? They did a lot in 2020. I think they were doing actually quite a bit, like even in 2010s in the biotech space. But I think that now they need the AI before they do the next kind of synthetic merge. That's my guess. I mean, I don't know, but it would make sense because most of, I mean, when they're going to do nanotechnology, what are they using? They're using AI to do that. So that makes sense. Really, that's the back door is coming from. Um,
Mhm.
yeah.
Some of the
So,
big firms to
well,
watch on that. If anybody wants to track it here, I tracked down some of the big firms on this, and you've got let me see here: Welsh, Carson, Anderson, and Stowe. You've got the Carlyle Group, of course. You've got Bain Capital Life Sciences, CBC Group, um, Linden Capital Partners, and those were the top six that were definitely dominant in the space. But we've even seen divestitures out of them. They haven't been growing; they've actually been pulling back. In the sovereign wealth funds, there's a few, like Qatar has some investments in it. Mubadala has some investments in there. Abu Dhabi Growth Fund has some. Of course, PIF, Saudi Arabia Public Investment Fund, and Hong Kong has a little bit too. But I don't see massive growth. I don't see a lot of stuff going in there that raises red flags, if that makes sense. It's activity, but it's not red flag activity.
so there is an area, and it might be interesting to do a little investigation into. There is a field of evolutionary AI, and it's not new at all, but they are working very closely with consciousness studies. And I'm not somebody who believes that AI is going to achieve sentience. I think they're largely invested in that narrative and convincing people. And I think that you convince enough people that it will achieve sentience, I think the ramifications of that could be quite devastating, actually. So I don't think it actually has to achieve sentience to do the destruction that it could. But I know they're doing a lot of studies on that, and I think I talked about this last time as well. I don't think it's a coincidence that they named it Project Stargate because the CIA Stargate operation was all about remote viewing and psychic capability. They were actually studying even like Kundalini, like yoga and meditative type psychotechnologies, right? Essentially, and how that could create altered brainwave states and potentially tap into some of this psychic ability. But I think that it's not a coincidence that they named this Project Stargate and they're trying to use AI to tap into or convince us that they've tapped into some of this technology. And I've talked about some of the people who are using this for their own little micro cults where they have necromancy for their following through AI that they've built. So that might be interesting to investigate, but I think I think it's a combination of psychological warfare that could be fomented through that. But they're also trying to figure out how they can tap into consciousness and whether or not they achieve success in it. I think they'll use it to manipulate whatever they possibly can. So, but yeah. So with that, thank you so much to my knights, and thank you to the audience and the people who asked questions, and we had a very active chat amongst them. And to Shannon Joy, I know she was streaming this as well. So thank you, and thank you to her audience. And I encourage everybody to share this information far and wide. I don't think that the powers that shouldn't be really like all this kind of discussion. So the best way to beat the algorithm is to share this information, whatever you can do, like it, subscribe on everybody's platform, and just get the word out, because I think the more that we raise awareness that this is even happening, the more that people can do to start to fight back. And I think with some of this stuff, people actually have a lot of autonomy. When you're talking about healthcare, I think there's a lot people can do. People can not opt into some of this, because right now a lot of it is opt in. So, not everything is within our control, but I do think that there are things that are in our control, but we can't control things we don't know about. So, just definitely disseminate this information. And with that, let's go around and everybody tell each where they can find you. And let's start with you, Craig. Where can we find you?
At Real World HD, do a show on Rumble in the mornings, and that's pretty much it right there. Or chasing around Courtenay and Aaron and Patrick, what they're doing. You'll see me in there commenting on their stuff, all the great work they're doing.
Thank
Thank you
you.
very much.
Yeah, thank you. And Aaron?
Yeah, sure. You can find me at daylightfreedom.org is the main place, and you can find me online at Aaron R. Day. I'm going to be launching a number of initiatives. So the next roundtable, I'll have something more specific to say about some of those. But you can also catch my podcast, The Aaron Day Show, which is on Mondays and Thursdays at 6 p.m. Eastern Time. Usually we have some great topics. Craig's on there often, and as is Courtenay. And we'd love to get Patrick on at some point as well. And so I encourage you to check that out.
You bet.
Awesome.
Yeah.
Patrick?
I'm on technocracy.news. That's me. That's everything I have basically is on technocracy.news. I also I have a Substack, but it basically mirrors Technocracy News. So that's what you get. Everything, all my books, my brochures, my boot camp, everything is there.
Awesome. And I'm Courtenay Turner, Courtenay, COURTENAYTURNER.com. That's the best place to find me, and then my Substack as well. And yeah, I guess we'll discuss what we're gonna talk about next time, and we'll be back next month.
All right.
So
Thank you.
thank you all.
Indeed.